Inflammatory breast cancer, it's rare but aggressive. Dr. Rashmi Benda of Boca Raton Regional Hospital joins us to answer your questions about this cancer. Thank you so much for joining us this afternoon and sharing some more information about this. What is IBC?
IBC, as you mentioned, inflammatory breast cancer, it's a very rare cancer. Most of the time when women think of breast cancer, they're picturing a lump that they feel or their physician feels or something showing up on a mammogram. This shows up, as the word speaks, inflammatory, meaning the breast looks red, hot, inflamed. A lot of times it's confused with an infection, so it's not uncommon for women to go see their primary care doctor, the gynecologist, and be placed on antibiotics for a week or so. And the key is that's an okay course because it can be confused with mastitis, which is an infection. But if the antibiotics don't help it within a week or so, that's when you need to pursue it further.
What are some more? You said the breast is red or swollen, but I mean, is it a real significant change in the breast?
It sometimes is subtle, but mostly it is a pretty significant change where the woman will notice her breast may be larger than the other side. It's red, and we call it peau d'orange. It has this orange peel appearance at times, which comes from some of the swelling, some of the fluid in the tissues.
Can there also be a lump associated with it?
There can be a lump. It is not always the case, but there can be a lump, yes.
Can it be diagnosed with traditional screening methods, or do you have to diagnose it by noticing the discoloration?
It's a clinical diagnosis. Mammogram will show some skin thickening, but that is not the typical way of picking this up. Usually it's a change a woman will notice and present to her physician. At that point, the biopsy will show infiltration into the dermal lymphatics, and that's within the skin. So you do a biopsy of the skin as opposed to a biopsy of the breast itself. It's called a punch biopsy.
I see. Dr. Benda, is it hereditary?
No.
It is not?
No.
Are there certain groups of people, though, who may be more likely to have IBC?
There's not you can't put them in a category, a risk factor, certain, for example, the hereditary breast cancers, they tend to be of a certain type. No, this is not something that can be linked to any known factors.
When it's detected, if a woman sees the discoloration on her breast and goes to a doctor immediately and it's diagnosed, can it be detected in its early stages, or at that point is it already advanced?
Well, it's not. When it's detected, it's already what we call a stage 3. It's not stage 4. Stage 4 would be metastasis gone elsewhere to the body. It is stage 3, which means it is curable.
So, and what are the treatment options?
Treatment typically is a course of chemotherapy to resolve the skin changes, followed by usually surgery, and surgery tends to be mastectomy in these cases, then followed by radiation post-mastectomy.
So if you have any questions, do see your doctor immediately.
Any skin changes at all.
You like to tell people they didn't need to come see you. You like to tell them it's not cancer, so go see your doctor if you've got any questions. Dr. Benda, thank you for your time. Boca Raton Regional Hospital sponsors our doctor and also underwrites our Ask the Doctor segment. Back with more in just a moment.